Polycystic ovary syndrome affects millions of women, but science shows that nutrition, lifestyle, and evidence-based strategies can make a real difference. Let's explore how.
Welcome to This Explainer. Okay, today we are diving into a massive, honestly game-changing paradigm shift in the care of polycystic ovary syndrome, or PCOS. If you or someone you know has been in the trenches with this, you already know the historical medical approach has been incredibly frustrating. Usually, it's just about slapping a generic Band-Aid over the symptoms and hoping for the best. But today, we're talking about a huge move away from that basic symptom control, and we're heading straight toward highly personalized, phenotype-targeted therapies that actually get right down to the root mechanisms of the disorder.
Just to put the sheer scale of this into perspective, as of 2010, the World Health Organization estimated that 116 million women worldwide are navigating this condition. I mean, that is roughly 3.4% of the entire global population dealing with a complex, frustrating, multi-system disorder. We are talking about a condition that disrupts reproductive health, throws metabolic balance completely out of whack, and takes a real toll on psychological well-being. So yeah, this is for sure far more than just a localized reproductive issue.
So here's our roadmap for today. We'll start with rethinking PCOS management, move into the lifestyle foundation, compare metformin versus myo-inositol, look at some high-tech fertility solutions, and finally, take a peek into the future of PCOS care.
All right, part 1, rethinking PCOS management.
Before we get to the really good cutting-edge solutions, we have to talk about how we actually define the disorder itself. Clinicians traditionally use the Rotterdam criteria for diagnosis. Basically, this requires a patient to check at least 2 of 3 boxes: oligo or anovulation, which just means irregular or absent periods; clinical or biochemical hyperandrogenism, meaning excess male hormones; or polycystic ovarian morphology, which is what they see on an ultrasound. But here is the kicker, and the major challenge for doctors. Because these criteria are so broad, PCOS literally looks completely different from person to person. One patient might be fighting severe insulin resistance and weight gain, while someone else might be average weight, but dealing with severe acne and reproductive roadblocks.
And that is exactly why we are finally tossing out that old one-size-fits-all approach. You can kind of think of the old way of treating PCOS like a generic, baggy t-shirt. It was designed to broadly fit everyone and just sort of mask the symptoms, but let's be real, it flatters absolutely no one. What clinical guidelines are moving toward now is more like a custom-tailored suit. We're targeting your specific phenotype and your unique metabolic profile. If your main hurdle is insulin resistance, your treatment should look entirely different than someone whose primary battle is hyperandrogenism.
Moving on to Section 2, the lifestyle foundation. The underlying biology here is just fascinating. Things like low glycemic index and Mediterranean diets, they aren't just internet wellness fads, they are legitimate medical interventions. Low GI diets put the brakes on those massive blood sugar spikes, which actively reduces the daily stress on your pancreas. Meanwhile, the Mediterranean diet serves up a heavy dose of antioxidants to fight the chronic subclinical inflammation that's inherent in PCOS. Add in a high-protein intake to keep you full and help balance your endocrine system, and you're literally rebuilding your metabolic foundation from the inside out.
Now, of course, you've got to pair that nutritional strategy with the right physical activity. The optimal prescription is hitting at least 150 minutes per week of moderate intensity exercise, combined with biweekly resistance training or HIIT. When you combine aerobic work to bring down fat mass with resistance training to kick your resting metabolism into higher gear, it creates this brilliant synergistic effect. It majorly enhances insulin sensitivity and, amazingly, has been proven in clinical trials to help restore menstrual regularity.
Okay, Section 3, metformin versus myo-inositol.
This is where the pharmacological battleground gets really interesting. A recent systematic review in the journal Curious highlighted a massive shift in how we handle insulin sensitizers. Metformin is the classic heavyweight for treating insulin resistance, sure, but let's be honest, it is notoriously rough on the stomach. Enter myo-inositol. It's a naturally occurring intracellular messenger, and the data shows it offers equal efficacy to metformin for improving your metabolic profile and restoring ovulation. But the best part? It comes with vastly better tolerance and significantly fewer gastrointestinal side effects, meaning patients are actually sticking with the treatment.
But, and this is a pretty big but, not all inositol supplements are created equal. Clinical trials highlight that you really need a highly specific physiological ratio of 40 parts myo-inositol to 1 part D-chiroinositol. That specific 40-to-1 ratio has demonstrated superior efficacy in restoring spontaneous ovulation and overall ovarian function compared to using either form on its own. It completely takes the guesswork out of the supplement aisle, right? It's precision dosing based strictly on hard clinical evidence.
Let's jump into Section 4, High-Tech Fertility Solutions.
For anyone facing reproductive challenges, the modern journey of fertility preservation is an absolute marvel of technology right now. We are talking about highly tailored ovarian stimulation protocols built around a patient's specific hormonal dynamics, followed by traditional IVF. But it goes way beyond that now. Clinics are utilizing pre-implantation genetic testing to actually reduce the transmission of heritable disorders. And on top of that, we're seeing the introduction of AI algorithms. These systems take all this complex embryological data and objectively predict the best implantation potential. It takes so much of the human guesswork out of embryo selection.
And here is a particularly crucial advancement for folks with PCOS: in vitro oocyte maturation, or IVM. Because women with PCOS are at a uniquely heightened risk for dangerous ovarian hyperstimulation during traditional IVF, IVM allows clinics to retrieve competent eggs while totally bypassing those heavy, risky hormone doses. When you combine that with freeze-all cycles, you're looking at a vastly safer, completely phenotype-targeted approach to egg retrieval.
And finally, Section 5, the future of PCOS care. Looking at the emerging frontiers, we are seeing some truly mind-blowing stuff on the horizon. First up, the gut microbiome. Specific lactobacillus and bifidobacterium probiotics are proving they can correct gut imbalances and actively lower plasma triglycerides. Then, there's traditional Chinese medicine. Modern research is actually confirming that treatments like acupuncture calm your fight-or-flight nervous system, resulting in an amazing 41% increase in ovulatory frequency. No way, right? And finally, epigenetics. Researchers are looking into DNA methylation inhibitors. These are essentially drugs that target the heritable traits of PCOS to reduce excess androgens at the molecular level.
Plus, the whole landscape of metabolic medication is totally transforming. GLP-1 receptor agonists, which you probably know from the diabetes and weight loss space, are rapidly replacing older drugs like TZDs, which famously caused unwanted weight gain, and they're taking over because they deliver massive targeted improvements. We're seeing an average almost 6-kilogram weight reduction, a staggering 31.2% drop in insulin resistance, and a 28.4% reduction in free androgens. It is basically a multi-system upgrade packed into a single, targeted therapy.
To bring this all together, this quote really hits the nail on the head. Contemporary PCOS management has progressed from symptom control to a precision medicine model, targeting multi-system manifestations. The medical community has successfully shifted away from just handing out generic symptom-masking pills. Instead, we are entering an era of deeply personalized care that addresses the root cause of your specific symptoms, blending endocrinology, nutrition, and advanced tech in perfect harmony.
So, knowing that treatments can now actually be custom-tailored to your completely unique metabolic and hormonal profile, I want to leave you with this final thought to maybe explore with your own healthcare provider. How will phenotype-targeted therapy change the future of your reproductive health journey? Thank you so much for hanging out with me on this explainer today. Stay curious, stay informed, and we will catch you next time.